Identify the clinical sign which is shown in this image. So the inference from this image is hip is flexed at 90 degrees and knee is also flexed at 90 degrees, and now the examiner is trying to extend the knee from this position. Okay, so what he's trying to elicit here, the examiner is trying to elicit Kernig sign. So what is a Kernig sign? Kernig sign is a sign of meningeal irritation. Okay, there is another sign for meningeal irritation, that is Brudzinski sign. Okay, this has three components again: Brudzinski neck sign, Brudzinski symphyseal sign, and Brudzinski cheek sign. So this is also a sign of meningeal irritation. What about option 1 and option 4? Option 1 and option 4, they are actually elicited in deep vein thrombosis. Okay, so these are signs of DVT. So in this image you can clearly see the same thing. Hip is flexed at 90 degrees and knee is flexed at 90 degrees, and the examiner is trying forcefully to extend it. And if the patient feels pain in the calf, okay, and if he resists, okay, if the patient resists extension, then the Kernig sign is positive. Similarly, the other image is showing Brudzinski neck sign. Okay, when you are trying to forcefully flex the neck, you can also see reflex flexion of hips. Okay, so reflex flexion of hips and knees on forceful flexion of neck is Brudzinski neck sign. What is Brudzinski cheek sign? On applying pressure on the cheek, okay, on the ipsilateral side, there will be flexion of the forearm and rise of the forearm. So this is Brudzinski cheek sign. And the third Brudzinski sign is Brudzinski symphyseal sign. So what do we do here? We apply pressure on the pubic symphysis. Okay, on application of pressure on pubic symphysis, there is a reflex flexion of hip, knee, and also you will see abduction of the leg. Okay, so you will see flexion of hip and knee and also abduction of the leg in case of Brudzinski symphyseal sign. So in the image here you can see the sign of DVT, that is Homan sign, very important. And what do we do in Homan sign? We try to forcefully dorsiflex the ankle. So on dorsiflexion of the ankle, if the pain is felt in the calf, this is Homan sign positive and it indicates DVT. But this is not either sensitive nor specific for DVT. The second sign for DVT is Bancroft's or Moses sign. So what is this sign? When you try to compress the calf muscle against the tibia forcefully, okay, so on compression of the calf muscle against the tibia, this will produce pain, okay, and this is seen in DVT. The third sign of DVT is Lowenberg sign. Okay, what is this? Lowenberg sign. And what happens in Lowenberg sign? We have to tie sphygmomanometer, that is the BP cuff, okay, and inflate it to 80 mmHg. When the systolic pressure is inflated to 80 mmHg, what happens? There is elicitation of pain if there is DVT. So Lowenberg sign is positive if there is pain in the calf on inflation of the BP cuff to 80 mmHg.